Have you ever thought about how medical tests, while incredibly helpful, sometimes might not tell the full story, especially when it comes to something as serious as an infection? It is a crucial question because understanding the nuances can really impact your health journey. A false negative tuberculosis test result simply means that someone is actually infected with the tuberculosis bacteria, but their test indicates they are not. This situation is important because it can lead to delayed diagnosis and treatment, which has significant implications for both the individual and public health. The primary reason for a false negative test often lies in the body's immune response, or lack thereof. When a person's immune system is weakened, perhaps due to a condition like HIV, certain medications, or even being very young or elderly, it might not be able to mount a strong enough reaction to the tuberculosis bacteria. This means the test, whether it is a skin test or a blood test, has nothing significant to detect, even though the bacteria is present. Another common factor is testing too early after exposure, during what is known as the window period, before the immune system has had adequate time to develop a detectable response. To help minimize the chances of a false negative, it is essential to communicate your full health history to your doctor, including any conditions that might affect your immune system or recent exposures to tuberculosis. They may recommend retesting after a certain period or utilizing different testing methods depending on your risk factors and symptoms. For instance, sometimes a chest X-ray or sputum smear may be used in conjunction with blood or skin tests, particularly if there is a strong suspicion of active disease. It is also worth noting that both the tuberculin skin test, or TST, and interferon gamma releases assays, or IGRAS, have their own specific limitations and sensitivities. The TST involves injecting a substance under the skin and measuring a reaction, which can be influenced by previous vaccinations like the BCG vaccine, while IGRAS measure the releases of specific proteins in a blood sample. Understanding these specific test characteristics helps healthcare providers interpret results more accurately, providing a more complete picture of your potential infection status. By being open with your healthcare provider about your complete medical history and any potential exposures, you empower them to select the most appropriate testing strategy for you. This collaborative approach ensures that you receive the most accurate diagnosis possible, leading to timely and effective care, and ultimately, safeguarding your well-being.